Hello. Visceral manipulation has been a very important part of my practice over the years and has been instrumental in helping a lot of patients feel better and relieving their common complaints, which are sometimes a mystery. Visceral manipulation has one component that I use quite a bit called visceral motility. Every organ has its actual motion that ebbs and flows like the ocean waves. Very fascinating. And it can be learned as a skill to feel the motility itself as it goes through an expire and an inspire range of motion, which we call an amplitude. To assess the given organ's motility, such as the liver, which we'll demonstrate in this video, can be a clue to either ligamentous tightnesses, visceral fascial restrictions, or emotional strains. We know the liver has emotional strains for certain emotions such as anger, resentment. That's just two. Join me for visceral manipulation courses, which will enhance your practice by far. Let's have a look at the liver's motility. The liver is located in the right costal margin, just a little inferior, maybe by 2 or 3 centimeters. And so what I'm going to do is I'm going to place my right hand over top of the costal area with my index finger over the costal margin and my other parts of the hand on the bare area of the liver. Resting my hand, I'm going to feel for the motility of the liver, which is going to be expire is moving towards the umbilicus and inspire moving back underneath the costal area. Every 3 to 5 seconds going to switch. The xiphisternal process is here, the sternal notch is up here, so I can feel all these bony landmarks. The convexity of the liver is about here. Placing my hand in there and just listen now and feel the liver move into my palm. There it comes. I'm assessing for the expire trajectory of the liver towards the umbilicus at this point. It fills up my palm starting down here and moves to the distal part of my fingers. Now its full amplitude is in expire towards the belly button. It's staying there for a little bit of time and then recedes back underneath the costal margin as it goes like this. And what I'm going to do is I'm going to stay here for about 2 to 5 minutes. I'm going to assess this amplitude range of motion and see if it's appropriate. I'm going to see if the way that this oblique trajectory works, it's going to be a combination of the range of motion in the sagittal plane, the coronal frontal plane, and horizontal plane. All 3 ranges of motion combine to come up to this oblique line, and this is controlled by ligamentous tightnesses. And we're going to find out the state of the liver. Emotions can affect this as an example of a way this can be affected. And I have treatment options I can follow. If the liver is having a hard time coming down into expire, I can use a technique called induction, or I would then follow the liver into expire a little further and hold it. And that's just one example of a great technique for the liver. There's also multiple techniques for mobility of the liver, which are direct techniques to either lift the liver. I can actually pull the liver down as well, depending on what is needed for the patient. And let's not forget that we have the stomach over here on the left side, which follows the same amplitude as the liver, basically mirroring it. We have the gallbladder about 4 chun lateral to the umbilicus along the rectus abdominis. There is the gallbladder. We also have some special tests to see if we have gallbladder stones in here. And we can also listen for the gallbladder. We can also listen for the cecum. We can listen for the sigmoid colon. We can listen for the small intestine. We can do all sorts of great things with visceral manipulation as long as we have a good mental topography of the area and we know where the organs are through anatomy training. We know where they are, we can feel them, we can assess them with motility first, then mobility we can test and treat. Join me for these great courses to enhance your practice. Absolutely.